Indian authorities are investigating a Nipah virus outbreak after confirming 2 cases. Now, several Asian countries are tightening health screenings and airport surveillance for travelers arriving from India.
Nipah spreads through fruit bats, pigs, and human-to-human contact, and there is no vaccine for the virus. NBC's Janice Mackey-Freyer reports from Beijing.
This is a highly contagious virus between humans, and it's often deadly. The 2 cases of Nipah virus were detected in India in the state of West Bengal, but there are concerns the outbreak could spread. The virus has a fatality rate of 40 to 75%, according to the World Health Organization, deadlier than the COVID virus, and there's no vaccine for Nipah. So authorities in India are taking no chances. At the same time, several airports across Asia, in Thailand, Singapore, Malaysia, and Hong Kong, are taking steps to screen passengers for any symptoms. Nipah is a zoonotic virus that's transmitted from animals, usually fruit bats, and doesn't spread easily to humans. It can also come from contaminated food. And when it does hit, it initially feels like the flu, then worsens. Experts say pneumonia and other respiratory symptoms can develop. But the most serious complication is encephalitis, or inflammation of the brain. The WHO says the fatality rate has a lot to do with the country's capacity to test, trace, and treat those infected. In India, authorities have quarantined nearly 200 people who may have come into contact with the 2 infected. It's the first time in nearly 20 years that India has had cases, but they believe the outbreak is now contained. Still, it's a situation that U.S. health officials are watching very closely, the CDC saying they're ready to assist if needed. Janice Mackey-Freyer, NBC News, Beijing.
And the last major Nipah outbreak in southern India was in 2018, where at least 17 people died. Right now, there are no reported cases of the virus outside of India.